Good morning, folks. Judge Executive Al Mattingly here, and as I had said I would, I'm going to try to continue our Wednesday morning reports to you regarding COVID in Daviess County and in the Grad region. I wanted to talk to you about how important the masks are and how some people don't believe they're important. You know, I was driving down Highway 60 West this morning, and someone had put a sign in the right of way that says, "Stop wearing masks, they don't work." I wonder where that person got their medical degree. I wonder where they studied epidemiology and infectious diseases. I wonder how long they worked at the Center for Disease Control. Masks work. The White House has said masks work. The state has said masks work. The CDC says masks work. For them to work, you have to wear them properly. And one of the things you'll notice, this is a surgical mask. It has a little nose piece, a little wire where you can bend it. And when you put that mask on, you want to make sure that you don't have it below your nose, that you have it covering your nose, high on the bridge, and that you pinch it so that it makes a tight seal. Masks work, but you have to wear them properly. I would liken this to, and I've used this example before, so if you're out in the middle of the field and there were a half a dozen trees and somebody happened to start throwing rocks at you, wouldn't you take cover behind those trees even though there are large gaps between them and you know the possibility would be that you could get hit by a rock? Well, you're utilizing what is available. This is what we have available to protect ourselves from COVID. Now understand that we protect ourselves, but primarily we're protecting other people. So we depend on other people to protect us and us to protect other people. And when we wear masks and other people are wearing masks, particularly when you're in close proximity, there is statistical evidence that you are much less likely to catch COVID. Doesn't guarantee you that you won't catch COVID. You just lower the likelihood. And I absolutely want as much cover as I can when somebody's chucking rocks at me. Now, people who wear face shields without a mask are people who, particularly in our stores, who stand behind plexiglass where there's an opening at the bottom without a mask. There's really not much protection there for people who come up to shop at that store. We had a conversation with Governor Beshear yesterday and Dr. Stack, all 7 judges in the Grad region, the Green River Area Development District region. And again, I've let you know that includes Hancock, Ohio County, McLean County, Webster County, Union County, Henderson County, and Daviess County. I think 4 or 5 of those counties are in the red zone now. Daviess County is not, and Hancock County is not, but 5 of those are. As of yesterday, McLean County, small McLean County, 9,000 citizens, was leading the state in rate per 100,000 population. Think about that. Only have 9,000 people there. And the report that I got today, it reports that McLean County has 10 more cases. Daviess County has 15 reported today. So Daviess County has 100,000 population. McLean County has 9,000. So on a 100,000 basis, we've got 15 per 100,000. McLean County would have 10 times 11 or 110 cases based on 100,000 population. Now, I hope that I didn't lose you in that math, but it's an extremely high rate for such a small county. Unfortunately, Daviess County today reported another death. Henderson County reported 4 more deaths. Those deaths are a result of COVID-19 getting into our long-term care, our nursing home facilities. You have to have folks work and provide care for our elderly. And I don't know how you keep it out. We talked with the governor yesterday about a plan to keep it out. I asked him about rapid testing, where people had to have a rapid test every time they went in to that nursing home. Right now, I think the state has made available tests where every employee is tested at least twice a week. It may be that they're going to have to be tested 4 times a week or 5 times a week, but it's critical that we control the spread in places like long-term facilities. It's critical that we control the spread in prisons and in jails. It's critical that we control the spread in our police departments and our fire departments. Those first responders are critical to the safe operation in our community. So I guess, just if you'll allow me, I'm going to look at a little cheat sheet that I created, but this is kind of updated today for most of it, but Daviess County now stands at 1,800 confirmed cases. So since March, we have had 1,800 cases confirmed. Of those, 1,580, 1,590 have recovered. Currently, we have 13 in the hospital, and as that number goes up, we typically see the number of deaths go up. It's kind of a parallel path. Ever hospitalized, we had 127. And adding the 1 death that was reported today to the 27 we already had, that means that 28 Daviess counties have died as a result of this disease. 200 current cases. So we got about 200 people who are out there and who are infected. Doesn't sound like a lot, but there are hundreds more probably walking around that are asymptomatic. They're spreading it, and that virus is just waiting to hop on someone who has an underlying medical condition or one of our elderly and cause them real concern. I have a good friend who used to be a judge executive. He and his wife both ended up with COVID. He said it was one of the hardest things that he had ever gone through, and his wife is still struggling because she has some underlying conditions. It's real and it's mean. We really don't know. There's a lot that we still don't understand. In a conversation with Congressman Guthrie several weeks ago, he felt confident that we were going to have a vaccine somewhere in November, maybe early December. I think Governor Beshear and Dr. Stack felt like possibly the end of the year, more than likely next year. And even if we got a vaccine here in the next few weeks, we would be using that vaccine to protect our first responders, our healthcare workers. It would go to them first, probably into our nursing homes to help protect those folks who are very vulnerable. So until we get a vaccine, which will help with what you've heard the term herd immunity, we all need to remember, wear our mask, social distance, wash your hands, and avoid large crowds. I hope you don't think that in my conversation so far that the implication is it's only occurring in nursing homes. That couldn't be further from the truth. That seems to be one of the largest segments that is showing infection from COVID. Funerals, seems like people have relaxed, let down their guard, and we're seeing a lot of COVID-19 being traced back to funerals. Weddings, again, we go to that wedding, everybody is happy, we get to dancing and having adult beverage, and we get to eating, and everybody starts hugging and kissing. We let our guard down. So those two, we're seeing a lot of contact tracing is tracing the infection vector back to those types of things. Large crowds, I mean, large crowds where you get together and don't hold it down to 10 people. You might have 25, 30, 50 people at a party. A lot of teenagers get together and you know, they bring it home to mom, and mom infects dad, and dad infects grandma, and pretty soon we're at a funeral. So we need to watch those things. In some states, they have reduced the size of crowds to no more than 5 people. In Evansville, the mayor just issued an executive order that said if you're going to have a group of people larger than 100 or 125, you had to get special permission. You had to get a permit for it. We don't want to be telling you what you may and may not do. You all have personal freedoms. We think you are adults. We think that we should be able to lay the information out and you to abide by it. But if we don't stem the tide, we've already hit another plateau. If we don't stem the tide, I suspect that you're going to start seeing some tighter restrictions coming down the pipe. Flu shots, important that you get the flu shot. There are a lot of anti-vaxxers, anti-flu shots out there. I don't know where they get their information. I'm sorry, I don't know where they get their misinformation. You can't get the flu from a flu shot. I had one person tell me absolutely you can. I got a flu shot that morning and I had the flu that night. Well, if you had the flu that night, you were already infected. Flu shots are just another tree out in that field where people are chucking rocks at you. Same thing, somebody said, well, if I wear a mask, I shouldn't get the flu. Well, yes, if you do everything right, but what have we found out with COVID? Even if you're doing everything right, folks still get the COVID. If you wear a mask, that's the first layer of protection. Flu shot is the second layer of protection. And believe you me, you don't want just the common everyday flu and COVID on top of that. It's a deadly combination. So I'm encouraging everyone to get your flu shot. If you don't have the money, call the health department. I don't know if they can help you, but call the health department. Most people's insurance will pay for it. A lot of people's employers will pay for it. If you can't or don't want to go somewhere and test, then look on the website for the Daviess County Health Department, and they have free testing every week. Free testing, and that's through all 7 counties, Grant counties. So there are a lot of opportunities to do that, to protect you, to protect your family, and to protect your neighbor. And it's going to take that kind of effort to get this under control. I don't want to be here next October talking about COVID-19. So have a good day. Everybody be safe out there, and I'll see you next Wednesday.